Hi, everyone. It's Marvin Music with MedicareSchool.com, and we want to welcome you to our daily program we call Medicare School Daily, sponsored by our company. This company I founded just about 20 years ago with my son Josh, and now we're a nationwide broker helping people all over the country making great Medicare decisions. We begin our relationship with education. We think it's very important for people to really understand what they're doing before they start making decisions, before they make a decision they're going to regret. And so since our founding of our company, we have always started that relationship with our clients with education through live workshops that you, of course, can find on our website, as well as a lot of YouTube content. So that's really what my days are filled with now, making sure that we're putting out good information so that people, as they go on Medicare, are making decisions that they're not going to regret. And so part of our program today is going to be taking your questions. And so I hope that you would like to, if you have a question that's stirring in your heart that you need an answer to, I would love to take those questions today during our broadcast. I'm going to give you the number you can call in to participate in today's show. It is 833-824-2004. Let me say it again, 833-824-2004. So if you have a question, please call in. And of course, our screener will take that, and we'll take any questions you have today about Medicare, really anything about Medicare, but also even about your situation. If you're not sure what to do, I'd love to give you some help with that, or any questions pertaining to Social Security. We help people with their Social Security planning as well. We are a comprehensive retirement planning firm, and so we can address any of those kind of issues that you would like to discuss today. Now, before I start taking the calls today, I do want to talk just a little bit about Medicare premiums. I've been in this business a long time now, and there are people today that believe that Medicare is going to be free, and Medicare is not free. Now, if someone has low income and low assets and they qualify for state Medicaid, then Medicare could be free to them, but everyone else is going to pay. And so I just want to go through and kind of break down the cost of Medicare. Medicare has four main parts, A, B, C, and D. Part A is the hospital side of Medicare, which almost always does not have a premium. And the reason that Medicare Part A is premium free is because as you and I work, we're actually paying into the Medicare tax system. 1.45% of every dollar that we make goes into Medicare, and the employer matches that. If you're self-employed, you pay the full 2.90%. And so as long as we have paid into that Medicare tax system through FICA taxes and self-employment taxes, then there's never a premium for our Part A as long as we paid in system for 10 years. They call them 40 quarters. We can get no more than 4 quarters in a year. So as long as we've accumulated 40 quarters, 10 years worth of work into that Medicare system, then Part A will be premium free for our whole life. Now, if someone doesn't have 40 quarters, then they can draw those benefits possibly from a spouse they're married to now, or from even an ex-spouse. There's some rules about drawing Medicare spousal benefits, but it definitely is possible. The main thing is that if you're married to someone now and you don't have your own 40 quarters, you had to be married for them for at least a year. You have to prove that with a marriage license, and that person has to be at least 62. If you're drawing from an ex-spouse, you had to be married for at least 10 years or longer, didn't remarry prior to the age of 60. And they also have to be 62 for you to draw benefits from them. 99% of all people either have their own 40 quarters or they get them from a spouse or an ex-spouse. And that's why there's, for most people, never a premium on Part A. Now, as we use Part A coverage, there's going to be some out-of-pocket costs for hospital deductibles and copays and those kind of things. But to be enrolled in Medicare A, 99% of the time is going to be zero premium. 1% has to pay a premium because they don't have 40 quarters. All right, let's talk about Part B. Part B is called medical. A is hospital, B is medical, and the B side of Medicare is everything outpatient related. And that is not going to be free unless you're on Medicaid. So what happens on Part B, that premium is based upon our income. So if you're on Medicare this year in 2026, the income that they're looking at to determine your Part B premium is is going to be your income in 2024. So they always look back 2 years. So the income we make today, 26, won't matter until 2028. And so if we're on Medicare now, 2026, they looked at 2024. The number they look at to determine our Part B premium is called Modified Adjusted Gross Income. We use the acronym MAGI, Modified Adjusted Gross Income, which is line 11 on your tax return, which is AGI, line 11, plus line 2A, which is tax-exempt interest. So when we're on Medicare, Medicare notifies the IRS that we're on Medicare, and they will ask for the Modified Adjusted Gross Income, line 11 plus 2A. And they report that to them, and that will then establish what we'll pay for Part B. Now, what they do is they actually have 6 different levels of Part B premiums. And the first level is what we call the threshold level. And the threshold is it's a dollar amount that if we stay below the threshold, then we pay the base premium or the standard premium that Medicare charges on an annual basis. It's monthly, of course, but they reset this every year. And so the thresholds for this year, for those that are single filers, is $109,000 modified adjusted gross income. So $109,000 or less, then you would pay this year $202.90 a month for your Medicare Part B. If you're married, that you file a joint return, then that's doubled. It's $218,000 for a married couple filing a joint return. Each of you then, if you're below that number, would pay the $202.90. Got it? So the threshold for single, $109,000. Threshold for married, $218,000. So we stay below it, pay the base, but if we're above that, then we pay additional amounts. And these additional amounts are called IRMAAs, Income-Related Monthly Adjustment Amounts. It's an acronym, and this is for people that are deemed to be high income, again, above the thresholds. I'm not going to go into all those today other than to say that there's 5 levels of IRMAAs. So above 109, above 218, and then once we get up into $500,000 for a single person, $750,000 for a married couple, that's the highest IRMAA. So we have these different marginal brackets in between, and so there's 5 of them. And so for people that are high income, what happens is they're going to pay more. And again, those 5 levels are going to range anywhere from the total IRMAA about the kind of the mid $90, $95 a month range upwards to about $575 a month extra. So those are added to our Medicare B as well as added to our Medicare D plan. So B and D will carry IRMAAs. All right, and so what happens, and what I want to make sure everyone's clear on, when we pay these premiums, if you're on Social Security, they're going to take those premiums, even IRMAAs, right out of your Social Security check. And so for those people that have already made the choice to take Social Security, they will pay those premiums through their check. But for people that have not, what happens is this. When you get your very first bill, that bill is going to be anywhere from 2, 3, 4, or 5 months. It's truly just random. It's kind of the lottery. I just started Medicare in January. And when I got my first bill for my premium for Part B, it was for 5 months. Someone else could have got a 2-month, 3-month, or 4-month, but it varies. But then after we've paid that very first bill, then what happens, then the government will then bill us on a quarterly basis. So it's every 3 months thereafter. Now, some people don't like the quarterly billing, so what you can do for your Part B and your IRMAAs, you can actually enroll into a program called Medicare Easy Pay. And this gives you the opportunity, instead of paying quarterly, that you can set up an ACH with your bank and with Medicare, and they'll actually draft that on a monthly basis. That's what I did. I enrolled in that. Now, keep in mind, if you do want to use Medicare Easy Pay, you still have to pay that first bill, whatever it is. You do the direct bill. So you're going to write a check or go online and pay the full bill, and then you enroll into Medicare Easy Pay, and then they will draft on the 20th of each month for the next month. And so it's a very good system. But what you also want to be mindful of is this, that once you take Social Security, then they're going to stop the Easy Pay system. And I'm just trying to give you some insight with this. If you do enroll in Easy Pay, I did it. I think it's a great system. But when you start your Social Security benefits, you would want to contact them and say you want to cancel the Medicare Easy Pay. So you do this about 30 days before you actually start getting Social Security. Otherwise, your very first time they could draw out a Social Security as well as Easy Pay. I've seen that happen before. It's kind of a double payment. You get your money back, of course, but it's a little bit of a nuisance. But I like the Medicare Easy Pay. And so for those of you that like to collect points for travel points and those kind of things, you actually can go online and use a credit card to pay for your Medicare premiums, including IRMAA. All right, and so my whole point to you today is that Medicare A is zero premium, Medicare B is going to have a premium based upon your income. And then when we get into other costs, sometimes people are going to take a supplemental plan. And that's what I have, and supplemental plans are going to cover some of the gaps that Medicare did not cover financially. And so, again, we pay a premium for those. And most of those, again, are going to be paid through some kind of an ACH type system. Okay? And so Medicare is not free. There is a cost. And if you have further questions about the different costs of Medicare, I'd be happy to field in any of those as well as we take questions. I'm in our studio today with Daniel, our producer. So, Daniel, I am ready for questions. All right. Well, welcome to the show. Who am I speaking with?
This is Jesse from Texas.
Hey, Jesse. Nice to have you on the program today, sir. What are your questions?
Well, I retired February 2nd, and I won't go on Medicare until July.
Okay.
So me and my wife are going to transition over to a Christian healthcare company until I go on Medicare in July, then she'll stay on that. And I was wondering if that would affect my when I sign up for a Part G or a Part N plan. Okay.
No, it won't. So what you're saying is that have you already lost your employer coverage?
I have it until the end of the month.
Into this month. So just a few more days. So you're going to start. Are you doing Samaritan Ministries or Christian Healthcare Share? Who are you going to use?
Christian healthcare.
Okay, very good. So you're going to be on that March through June, is what I hear you saying. Is that correct?
Yes, sir.
Okay, very good. Your birth date is when in July? Okay, very good. So, yeah, you'll start your Medicare July. So your question to me was, is that going to affect getting a G plan or N plan? And the answer to that is no. And the main reason for this, Jesse, is that we have people that are even uninsured totally, and they're still going to be able to come into Medicare and get a supplemental plan because the very first 6 months of your Medicare B date, which is July, you're in what's called the Medigap open enrollment period. And that's a period of time when the insurance company has to issue the policy. They're not going to ask you any health questions. They will cover all pre-existing conditions. And so regardless of what you had prior to starting your Medicare, makes no difference at all. There's no penalties for it. They can't have some kind of a waiting period where you're not insured at all. So you don't have to worry about it. And what I'd recommend doing, are you already on Social Security?
No, sir.
Okay. Are you going to wait for a while?
I'll start that in July also.
Okay, you're going to. All right, sounds good. So what I would do if I were you and Jesse, we'd be delighted to serve as your broker if you'd like to use us, but you're eligible July, so let me back up the clock, 6543. So you can actually start an application for your Social Security benefits 4 months prior to when you want them to begin. So you actually can do this all in March. And if you'd like us to help you with that, we do that all the time. And so when you self-enroll into Social Security and Medicare, that system will open up for you in March, and you're applying for Social Security, and then the Medicare questions will also be a part of that same application. So you would say, I want A, and I want B, of course. And then what I would do, if you want to start everything at the same time, they're going to ask you, when do you want to start your Social Security? And so if you want your first check in July, then you're going to need to start your Social Security in June. And if you want your first check in August, then you can start those in July because your Social Security payment is always 1 month in arrears. Okay? And so there's no effect. Your Christian healthcare ministry is fine to use. And then you'll just cancel that effective July 1. Your wife, of course, sounds like she'll stay on that for a little bit longer. And then everything else will go into effect for you July 1. Okay?
Okay. One other question.
Yes, sir.
Can I still contribute to my health savings account until July?
Yes, you can. You can put it up until the month of June, no problem. Even if you apply in advance, as I'm suggesting in March or April for everything, your A date is going to be July 1. So you're fine to contribute through June. And if you're putting the max in, that's going to be about $2,500. I think you can put individually about $450 a month right now. That's the the standard contribution plus the $1,000 a year catch-up. But it's prorated. You can't put the full annual amount in, but you can put it prorated up to the maximum. Does that make sense?
Yes, sir. Yeah,
Okay.
whatever the max is, divided by 12, and
You got it, plus the catch-up. Don't forget that the extra 1,000. I'm thinking this year, if my memory serves me correctly, I'm pretty sure it's about $4,400 for an individual contribution this year. I may be off a little bit there, but I think it's $4,400 plus 1,000 catch-up. So that'd be $5,400 divided by 12 times then 6 months, and you can that'd be the right amount to put in your HSA. Okay.
thank you very much. I enjoy your show.
Yes, sir. Thank you. Appreciate the call today. All right. Next caller. All right. This is Marvin Music. How are you today? Who am I speaking with?
You're speaking with Steve,
Hey, Steve. Nice to have you calling in today, sir. Where are you calling from?
Wisconsin.
Wisconsin. Very good. Okay. Go ahead, Steve. How can I help, sir?
I have a Social Security question for you.
Okay.
My wife is going to be retiring at the end of May of this year, and her full retirement age will be a few days later on the 6th of June.
Okay. Okay.
So when she applies for Social Security, would she use June as the starting date and receive her first check in July then?
You're exactly
Is that
right.
correct?
Yeah, that's exactly right. Hey, Steve, do me a quick favor. What's your wife's date of birth? 1959. So she has 66 and 10. So the way we would count that, let's just double check for you, okay? So we have, you said 59, so 25, 8, 1. So let's count it. 9, 10, 11, 12, 1, 2, 3, 4, 5, 6. You're right. Okay, so 6 of 26 is her full retirement age. And so what's going to happen if she does her application, they're going to ask her, when does she want to start her benefits? And they're going to say this: do you want to start at the time when you will not receive a permanent reduction? That's the question. And the answer to that is yes. She does not want to take a permanent reduction, which means they would start her benefits then June of 2026. If she takes if she were to start in May, it would be a minimal reduction, but it's still going to be a reduction. So when it comes to the question, when do you want to take, they'll ask you that. And she says, I don't want to take a permanent reduction. And then they'll start her benefits for sure the month of June. And then her birthday means her direct deposit would come by the second Wednesday of July. Okay, so
Okay.
they deposit based upon our birthday. So people are born in the first 10 days of the month. They get their check deposited by the second Wednesday. Next 10 days, third Wednesday. Last 10 days of the month, the fourth Wednesday. Okay.
The second part of my question is, her birthday would be August 6th of this year. Would there be any advantage for her to wait until her birthday when she turns 67 to apply for Social Security?
Okay, well, here's what happens. Every month after you've reached your full retirement age, her account is going to grow by 0.67%. It's 8% annual.
Okay.
But they do it, it's monthly. You don't have to wait for the whole year to get credit, but it's 0.67%. So take her benefit amount, whatever she's due at full retirement age, and add 0.67%, and that's how much it's going to continue to grow on a monthly basis. So it'll grow a little bit if she wants to do that.
All right.
Okay.
Well, I think you've answered my questions. I really appreciate it.
Yes, sir, Steve. Thanks for calling in today. Nice to talk to you, sir. Thank you. All right. I just also want to just quickly say, if you're viewing and have a question, feel free to call in. Our show's about half over, so I still have plenty of time. And the call-in line is 833-824-2004. Again, 833-824-2004. I'm thrilled to take your questions today. And then if you need immediate help, our company, we're brokers, of course, and so we have agents that would be able to help you even today if you'd like. Feel free to call in. And when you call in to that number, it's 833-833-3661. And any agent that you would talk to is an agent that I work with day in, day out. I'm here in the office today, just in the studio. And so we have agents that are well-trained, who will care about you, that will be they'll give you instruction, they'll give you direction, really for any decision that you want to make. Even if you just want some simple advice, we'd be happy to take those as well. So 833-833-3661 gets you to one of our live agents. All right, so ready for our next call. All right, well, welcome to Medicare School Daily. Who am I speaking with, and where are you from?
Yeah, this is Lee Travis. I'm from Metro Atlanta.
All right, Lee, nice to have you on the program today. What's your question, sir?
Okay, I am on traditional Medicare and got a supplement plan, but my Part D just got a notification that it's doubling in price. And I know every year each part of Medicare goes up a few dollars here and there, but like I say, this was just a straight doubling from $50 to $100 a month. So
it went. Okay. Let me ask you. You're saying you just got that notice?
Yeah, this past couple of weeks or so.
Really?
I don't think it's kicked in yet.
Okay. Well, because now, how long have you had that particular Part D plan?
Ever since I started, which was at about 7-8 years, I guess.
Is that right? What do you? Who's the carrier on that? Is it United Healthcare?
That's SilverScript.
SilverScript. Okay. Well, number one, Lee, I don't know why you're just now getting a notice, because the plans come up for renewal every year, October 15th through December 7th. And then that's the opportunity whenever we get to, switch plans if we need to, and the new plans go into effect January 1. So, we're into February here, and you're just not getting notice. So I don't know why why this is just now happening. That's not the norm. So,
well, I don't have the paperwork in front of me, so but I'm pretty sure it was just several weeks ago.
Okay. Well, here's what I want you to do. Let me tell you what I would do. I would go to Medicare.gov, at that website, and you probably have an account, but if you don't, then you don't necessarily have to create an account. But I would Medicare.gov. Create an account, and then what you want to do is you're going to click on the button where it says Find Health Plans. And so when it opens up to Find Health Plans, you're just going to click on the one where it says Medicare Part D plans. And I would click on that, and then they're going to give you the opportunity to put in your medications, and I would do that. And then after your meds are in there, it's going to ask you, do you want to compare prices? And of course you do. And then they'll allow you to pick up to about 5 different pharmacies, and pick a couple that you'd be open to on the retail basis. I would definitely put in at least 2 or 3 just to make sure. CVS or Costco, Walmart, Walgreens. Yeah. You got the routine. So once you've done that, then it's going to shop the plans. And so then what's going to happen is it's going to take all the plans based upon your meds, your pharmacy choices, and it's going to rate them in the order of cost and coverage, best to worst, the least expensive to the highest. And it could be that SilverScript plan is still in your best interest. It could be, but let's say that let's say there's 10 plans in your zip code, and it happens to be 5 or 6 or 7 in the list of 10. What I would do then is I would look at the plan at the very top, and I would click on that, and I would try to enroll into that plan. Okay, try to enroll. Now, that we're outside the enrollment period. However, when you go through there and you try to enroll, it's going to say, well, why are you trying to enroll now? And so then they're going to give you some options for special enrollment periods, called special enrollment periods. So if by chance in the state of Georgia you have the option to click the button that says State Pharmaceutical Assistance Plan, then I would click that button and see if you can then proceed with your enrollment. Because what I'm trying to teach you is this: you're outside the normal enrollment period. October 15th, December 7th is when we do all this. But there are special circumstances where people can enroll into a drug plan outside of that. But that's what all those different special enrollment period reasons and codes are all about. So if you see one in there that is applicable to you, then you can click on it. I don't know which one it's going to be, other than if Georgia has a state pharmaceutical assistance program, which I think they do, that normally will allow you then to go ahead and enroll into a drug plan that then would go into effect March 1. So I would do that today, sir. I really would. Now, if you can't do it, then you're stuck on that drug plan for the rest of the year. But again, it still may work for you. I think SilverScript is good. Of course, it's it was owned by Aetna and then Cigna Bottom, and now it's HealthSpring. But I still think that's still a good plan. Let me back up and say that. Now, this Aetna still owns the SilverScript plan, not Cigna HealthSpring. My bad. But I think it is a good formulary. I like that. I got lots of people on that plan. But I just think, when they took that hefty price increase, I hate to see having to pay that much if you don't need that type of a plan. Okay?
Yeah, I mean, it's not detrimental to me to have to pay that. I'm just curious and again, you answered my other question about enrollment period, because I knew that the enrollment is in the fall. So
yes, sir.
I don't know where this came from, and maybe it's all an error, and I don't know, but I haven't seen it come across on my accounts yet as far as the price increase. So
okay,
anyway,
they were allowed to go up.
My questions.
Okay, that sounds good, Lee. I was going to say they were allowed to go up $50 this year. That's the max increase, and some of the companies took that. So, anyways, that could be.
That's about what the letter said it was doing. So
okay, sounds
fine.
Good. All right. Well, you got maybe a
Thank
plan
you very
B here
much.
if you need it. Nice to talk with you today. Appreciate the call.
Thank you. Goodbye.
All right, take care. Hey, just before we get to our next caller, I want to mention that we also have a Facebook group, and if you'd like to join the Facebook group, I think there's over 50,000 people in the group, people that like to kind of share their experiences with Medicare and ask questions. And so if you'd like to join that, it's Medicare School Facebook group community. And you can be a part of that group. We'd love to do that. And then we had a question that just came in that I want to answer. I think it's probably in the minds of a lot of people that undergo surgery. So here's the question through the Facebook group. A gentleman writes, my wife will be having surgery in 2 weeks. She will be having her thyroid removed and all or part of the parathyroids removed. It will be at a hospital, but as outpatient surgery with Medicare A, B, and G, what will be the copays and deductibles? And so in regards to that question, because even though it's in a hospital, it's still going to be in an outpatient type setting. And so Part A of Medicare is not going to be participating in anything with that claim. And so on the B side of Medicare, which is what we call medical insurance, that side has a deductible. Each year that deductible is reset. So this year, if this would be the first claim, you're going to have to meet that deductible. It's $283. So the first $283 will be out of your pocket, and then all the remaining bills. This is going to be for the outpatient facility fees, for the doctor, for the surgeon, the anesthesiologist, and all the equipment. Everything that's going to be used in that operation is going to be at 80-20. Medicare is going to cover 80% of that, and then you'd be responsible for 20% of the cost. However, because you do have a Plan G, that Plan G is going to cover everything, because with the Plan G, it covers everything but the B deductible. So again, this operation, the thyroid and everything else that's going on is only going to cost you $283. And then if there's any follow-up visits after that, again, those are going to be covered at 100% as well, because the G is the most comprehensive plan available to people today. And so other than that minimal out-of-pocket of the deductible, everything else is going to be covered. Okay. In fact, that's the plan that I chose. Another wonderful plan would be a Plan N, and it would be very, very similar here on the Plan N, because it's going to cover that full 20% as well. But what could happen with, like, if a person had a Plan N, then if they had some additional doctor visits for follow-up, then they could have to be subject to some copays for those up to $20. So the G and the N, top two plans today, but either one of those would really provide very, very good coverage, minimal out-of-pocket expenses on an operation like this. Hello there, this is Marvin. Glad to have you with us today. Who am I speaking with?
Yes, hi. Good afternoon, sir. My name is Jeta Ionescu.
Okay, and where are you calling from?
I'm calling from New York.
New York.
And the reason I'm calling you, yes, I did ask you a question in the previous video, but something came up and I didn't hear the answer to my question.
Okay.
To make a long story short, I'm 55. I'm from New York. I'm on disability right now. And I don't know about prescription. This year I understand everything changed, but they say I don't qualify for extra help for my prescription. Is it anything I can do? they say because I receive Social Security and my pension from my union. I've been a housekeeper, doesn't matter, on the hotel 23 years. So they say it's too much. Is it true? Because I don't trust even people from Social Security. I don't.
Sure. So did you at one time qualify for extra help and then you lost that eligibility?
Yes, last year.
Okay. So
yes, this year they yes.
Yeah. What changed in your income that caused you to lose that eligibility?
I have the same pension from the union every year from Social Security. They say because it's going up this year, whatever they.
I see. So you're.
Yes, I do receive more than 2,000. Yes,
okay, so you're above the threshold. Okay, so let me ask you this: what particular medication right now is painful for you out of pocket? Which one is it?
It's Ubrably. It's for my migraines. They asked me the pharmacy $750 to pay out of my pocket, and then $136 a month. I can't afford to pay those money.
Okay, so is there any other possibility of a drug that would also be effective for you?
Well, the other prescription for anxiety, panic attack, they go up, but not too much. I understand from $3 to $16, but this one, particularly for my migraine, probably is going up.
Yeah, well, you're probably having you're having to meet the deductible. That's what's painful for it. That's probably a tier 3, tier 3 med and up. You're having to meet the $615 deductible, and then you're paying that copay. Here's what I would do: I would try to reach out to the manufacturer and see if they have any kind of a program. That would be one option. Another option that you could ask for, and I don't know if this will work, but it could. You could actually ask the plan to give you a tier exception, because that's probably a tier 3, tier 4, tier 5. And so when you ask for a tier exception, you're asking them to lower the tier. And so they could take it from a 3 to a 2, or from a 4 down to a 3, or whatever. So that's an option as well. And you can usually get a pretty quick answer on tier exceptions. I have seen them go through before. So that's the two things I would do. I'd go to the manufacturer, see if they have a plan that's possible you'd qualify for, or a tiering exception actually through the Part D plan itself.
Yes, because they told me I have Part D, A, B, and D, but I don't have for the lower prescription, which is, I have it this year. I'm not here to give name. I have friends the same money like me. It's like they choose and pick, and I'm going crazy with this medication. Yeah, well. But I'm gonna follow your.
Yeah, please do.
Yes.
Please do. If you lost eligibility, that's about your only two options. But hey, it was nice to talk to you. I appreciate the call. Have a good rest of your day.
Listen, I just wanted to say thank you, and I follow you on the Facebook. You are wonderful. When I sign up with Aetna, I sign up with your help, and I recommend many friends with your school because we trust you. We don't know who is in the other end of the line, but you guys do a wonderful. I really want to hug you right now. You're a wonderful man. Thank you so much.
Hey, you are very welcome. It's our privilege to serve you. Thanks for allowing us to be your broker. And thanks for the call today.
Thank you, sir.
Okay,
Bye-bye.
You take care. Just before we wrap up today's show, I just want to make a couple comments about our last caller. Many people have difficulties being able to pay for their prescription medications. And so, first off, when it comes to Part D plans, things that are very important to remember is that when we get a supplemental plan, our Part D plan is going to be separate. It's going to be what we call a standalone drug plan. In most zip codes, we have anywhere from 6 to 10 different plans that we can look at. And the premium on the plan is not the most important. The most important thing is, will my medications be covered by the plan? Now, premium matters, of course, but I would much rather pay a higher premium if all my meds are covered than pay a lower premium and then some not be covered. So that's one way we get meds covered when we get a supplemental plan. Now, when we have a Medicare Advantage plan, what happens is the plan itself is going to actually pick out a Part D plan and include that or embed that within the plan. And so when someone goes on Advantage plan, not only are we paying attention to make sure our doctors are going to be in network and our hospitals are in network, but also that our medications are covered well, because some Medicare Advantage plans have average drug plans, some have very good ones. So you just want to make sure that you're looking at that component as well. Now, once we've decided upon a plan, there are some ways to get some assistance. One way is to do what this lady had qualified for, then lost the qualification because her income exceeded the threshold, and that is called Medicare Extra Help. And this is only about Part D plans. So what Extra Help does for those that qualify with their income and assets below a certain threshold, then the government will actually cover the premium for the Part D plan if there is a premium, and usually there's some. But more importantly, what they do is they reduce the out-of-pocket expenses drastically. You'll still have some co-pays, but they're very, very little. So that's the Extra Help program. So if you do qualify for that, you definitely want to make application for that. Then another program that people can benefit from would be if they're low income, low assets, they actually can apply for what's called a Medicare Savings Program. Medicare Savings Program, and what these do, these help people cover their Part B premiums and other out-of-pocket expenses that they would experience on Medicare. And so those are Medicare Savings Programs. You can apply for those through Social Security offices as well as the state Medicaid. And then what happens with people that are, they do qualify for the Medicare Savings Program and the Extra Help Program, then what's going to happen with them is they're also now eligible for what we call special needs plans for Medicare Advantage recipients. So again, we qualify for Medicare, Medicaid, that's called dual eligible. And there's some wonderfully designed Medicare Advantage plans for people in that kind of a position. They have good coverage, very little out of pocket, if anything. There's no premiums that have to be paid. And then the drugs are going to covered as well at, really a fraction of the dollar. And so I'm sharing all this with you because drugs can be painful. And so if there's some programs out there you qualify for, definitely make application, and you can see some of those costs go drastically down. Now, this lady had a situation where she didn't qualify any longer, and so that's why I was recommending possibly going to the manufacturer, because sometimes manufacturers will have programs available. I've seen some of those. Another option that we have, you can always take some of your meds and compare your plan prices with what a GoodRx coupon would be, or a single care coupon, or Mark Cuban's company, which is called Cost Plus Drug Company. And they take just a small markup and then add a fill fee and a shipping fee, and some of those prices can be very, very attractive. And so there are ways that you definitely can get some help. And then also one more thing, there are some states that actually have some additional assistance for Medicare premiums as well as prescription drugs. Those are called State Pharmacy Assistance Program, and then state-specific plans. And so again, when you're struggling paying for these different prescriptions and out-of-pocket expenses, reach out to some of these agencies and see if you can't get some help that way as well. And so again, you have to requalify typically on an annual basis, but it's definitely worth your time to bring some of these costs down. All right, I want to thank everyone for joining in the program, especially those of you that called in. And we, of course, have this show every day, and we'll be back again on Monday from 11 o'clock to 12 o'clock. That's Central Time, so this coming Monday. Now, if you need immediate help and would like to speak to one of our agents, then you just need to call this number. It is 833-833-3661. Again, 833-833-3661. When you call in, that's our switchboard, which is open Monday morning through Thursday, 7 a.m. to 7 p.m. And on Fridays, it's 7 a.m. to 6 p.m. And so if you need me to help, we'd be thrilled to be able to assist you, answer your questions, walk you through really anything that's going on with your situation with Medicare. And then those of you that will be with us on Monday, be sure to call in. We'll take your questions about Medicare and Social Security, hopefully just give you some great advice so you can make wonderful Medicare decisions. We'll see you next week. Thanks.